Okay, welcome to Dr. M's Functional Medicine and Sports Medicine. This is Brain Fog Part 1. Do you have brain fog? Does someone you care about have brain fog? Have you ever had brain fog? In my functional medicine, brain and neurologically centered practice, I have seen a much higher number of patients per week with brain fog since 2020. I routinely ask my patients if they are bothered by brain fog, and if they come in for anything other than a specific orthopedic problem, we'll ask them, are you bothered by brain fog? Here are some of the questions, and you can answer them yourself. Do you ever feel like you have brain fog? If so, how long does it last? Is it every day, or how often do you have it? Do you also have any of the following? Decreased brain energy to do mental tasks, decreased memory? Are you having word finding difficulties? Are you having difficulty focusing? Those are basic questions about the brain that are important to ask. So, what is brain fog? It's a feeling like your mental processing is slow. You may feel like you literally are walking in a fog, or your brain's in a fog, or it's just really slow. You may not feel mentally sharp, and likely you're not going to feel mentally sharp. You may feel like you're in a fog, but it's actually feels like it's in your head. So, how would I rate the severity and seriousness of that symptom? Well, do you simply have brain fog that's off and on, or do you have brain fog that is constant? If it's constant, it's more of a problem. Do you have brain fog with other cognitive problems? If it is, it's a serious symptom. Brain fog may be associated with other cognitive brain problems, like you can't multitask very well. You have trouble finding words. You have trouble following a conversation or parts of a conversation. So there's quite an overlap between cognitive impairment and brain fog. But if you also, or someone you know also has cognitive impairment, this is more serious. It really needs a full evaluation and a really good functional neurology treatment program. If your brain fog is associated with depression or other mood issues, both the brain fog and the depression and the mood issues need to be addressed. And often depression and mood issues are related to brain inflammation or what is going on in the brain, as opposed to, quote, a deficiency of a medication. So it may not be all the time, this brain fog, but it's not normal. I've even had patients laugh when they say they have brain fog, or, I've had memory problems for the past 10 years, and they're only 53. So that means the memory problems started 10 years ago when they were 43, which means it's a pretty serious problem. And having memory problems is not normal either. So I like setting goals for my patients, not just after New Year's, but anytime. So here's a goal you might want to have, or you might want to have someone you care about have. I wish to understand and treat the most important factors adversely affecting my brain. I will do the work I need to do to have the healthiest and sharpest brain without brain fog. So that brings up another issue. What health goals do you have, and what are you doing about them? And are you setting a priority for your particular health goals? Because keeping your brain sharp needs to be on everybody's list. It's not just something for people over 60 or 70. So what are the actual mechanisms of brain fog? It almost always involves brain inflammation. It almost always involves neurotransmitter issues and dysfunction. It involves slowing of electrical transmission in the brain. It may be inflammatory molecules reaching really high levels in the brain. And there are often dysfunctional populations of what's called microglial cells that may be producing inflammation molecules. So microglial cells, if you don't know what they are, they're support cells in the brain. They're supposed to produce growth factors, and they're not supposed to produce inflammatory molecules. They're supposed to trim synaptic networks, and if they do, then they're doing their full job. Now, when they get damaged by viruses or vaccines or head injuries, or autoimmunity. There's many things that can damage them. They don't function properly, and they can go from the normal phase into what's called an M1 phase. And in that phase, they can't produce growth factors very well, and they're producing inflammatory molecules. And this is a very bad situation. And it's a common situation in a lot of brain-based problems, including Parkinson's, MS, and a lot of other neurological-based problems. So brain fog itself is a symptom. It's not classified as a disease, actually. But if you ignore it, it can become more frequent or associated with other brain-based symptoms and then become pretty serious. So what other symptoms could you develop if it got worse? Well, headaches and migraines, memory problems, poor brain energy. What does that feel like? It feels like you can use your brain for a period of time and then you just feel done. You could have word finding issues. You could have vision issues, poor functioning at work or school, and problems tracking conversations, among just a few of these symptoms. So here's a list of some things that could cause brain fog, and it's a pretty long list. So buckle up. Anything that causes brain inflammation can cause brain fog, okay? There are certain things called excitotoxins like MSG and aspartame. So one practical point here is if you chew gum, make sure that gum does not have aspartame in it. And I ask everybody who's chewing gum that comes into my clinic, tell me the name of the gum, and most of the time these gums have aspartame. So make sure if you chew gum, it has sweetened by xylitol with an X. Also, MSG is no longer included in ingredients, but it's in many things. If you want to know if any of your packaged foods have MSG, then do a search called hidden sources of MSG and avoid those things because that can cause brain fog. Also, any condition or process that causes hypoxia to the brain, which means low oxygen content. And guess what? A lot of people's red blood cells are really damaged these days, and they're not delivering oxygen very well to any part of the body, including the brain. And the brain consumes more oxygen than practically any part of the body. So this may be a problem for a lot of people. A concussion or a traumatic brain injury can cause brain fog, and that can go on for a while, and it can become chronic. And if you have a problem with gluten and you're still eating it, that can cause brain fog. Now, did you know that people can get autoimmunity in the brain? And everybody assumes it's just from the neck down. But there's ways to measure antibodies in the brain. One of the tests is called a NeuroZoomer Plus with a company called Vibrant Labs. And then another company, Cyrex, has a panel for this. But if you develop autoimmunity in the brain, it means part of your immune system is attacking brain tissue. And this is a very serious problem, and it leads to brain fog and other issues too. Blood sugar abnormalities, if the blood sugar goes too low or too high, can cause brain fog and brain problems. Hormonal issues like low thyroid, low adrenal can cause brain fog and fatigue. Fibromyalgia can cause brain fog. It's called fibrofog. And so there's other reasons for this that can be related to fibromyalgia, including inadequate sleep associated with the fibromyalgia. Chronic fatigue syndrome that has a cause of viral illness, Lyme, mold, or whatever the cause is can cause brain problems. Then your medicines could cause brain side effects. Some very common medicines to do this are pain medicines and medicines like Neurontin and Lyrica, and there's a lot of medicines that could actually do this. Food allergies could cause brain fog, actually, so you might want to get a food allergy panel to determine if there's significant food allergies or gluten issues. Mold exposure can cause brain fog from the mold toxins. Lyme and co-infections and viruses, especially viruses like COVID and Epstein-Barr and CMV, can cause brain problems. Post-vaccine brain fog is when someone got a vaccine and they're still having brain-based problems since then. Systemic inflammatory conditions that might be thought of as being mainly in another part of the body can actually cause inflammation in the brain and cause brain fog and brain problems. Heavy metals like platinum, mercury, aluminum, lead can cause brain fog and brain damage. Deficiencies of sex hormones like estradiol, progesterone, and testosterone could potentially contribute to this. And also electromagnetic exposure from your Wi-Fi and from cell phones and from 5G towers can damage the brain. So a practical solution I want to say from that is turn your Wi-Fi off at night and don't hold the cell phone to your head. And when you sleep, keep that cell phone at least 10 feet away from your head. So in regard to the oxygen issue, one of the key things that's related to low oxygen is sleep apnea. So if you don't breathe well at night, or you snore, or you stop breathing, you need to get a sleep apnea test. You can get one for home. You can also check your oxygen status on a spot basis just by wearing a pulse ox. And you can do a fast walking test to see if it goes below 90%, which is pretty serious. Okay, so how would you start to decrease and heal your brain fog? Well, first and foremost, you got to take some basic precautions. And I think one of the biggest deals is what is causing it. And one of the fallacies in conventional medicine is just there's one label for something, a diagnosis, and one treatment, and one cause, or they don't look for causes. In functional medicine, functional neurology, we look for causes. And so one of the things is find a functional medicine doc that's very trained in the brain, that can deal with concussions, that can deal with neurological problems, Parkinson's, MS, that really understands the brain, to help you figure out what are all the possible different causes. And you may need actually laboratory testing for viruses like Epstein-Barr, CMV. You may need spike protein testing for long COVID. You may need testing for mold, mycotoxins. You might need testing for heavy metals and for Lyme and other tick-borne illnesses to try to figure out why this is going on. Okay, so just to give you a few suggestions on food to start helping brain fog, choose organic whenever possible. And mainly what this means is these foods labeled organic supposedly have less pesticides and less herbicides. They are not 100% clean of everything that's a problem, but it is better to lower your load of herbicides and pesticides. And then choose grass-fed, cage-free things like eggs, grass-fed meat. Choose non-GMO products. And remember, GMOs are not labeled as having GMOs, but there can be a non-GMO label on them. And then decrease your exposure to plastics, which is kind of important. Did you know that there's been autopsies of people that have died from brain problems, especially Alzheimer's and dementia, and they found enough plastic in their brains to almost equal a big plastic spoon. So don't, try to, when you go to the grocery store, try to get brown paper bags to put your groceries in. Limit the plastic bags. Don't ever heat up anything in plastic. Decrease drinking anything like water or other fluids in plastics. And then there's actually a vegetable that's very good for the brain. It's called parsley. And probably most of you don't use very much of it. And I didn't used to use very much of it. And now it's one of my brain's sort of super vegetables. It has something called apigenin in it. And apigenin helps convert the damaged microglial cells to more healthy microglial cells. So I suggest you put parsley on your salads. I suggest you make a parsley pesto where you combine parsley with basil and even cilantro, and even leave the cheese out, and then put it on vegetables, eggs, meats, all chicken, all kinds of things. that you eat. And then other basics: sleep at least 7.5 good hours a day. Remember that if you sleep less than 7 hours, 7 full hours, your brain and body are going to be inflamed for probably about 4 days. And so if you do that more than once a week, your brain and body are inflamed all the time. So get it past 7 hours for that. And then increase your BDNF, which is brain-derived nerve growth factor, by exercising, as many days a week as you can, but walk at least 30 minutes daily if you're not doing any other cardio. Otherwise, get in some other cardio. And then we'll get into more what, zone of cardio you should be doing, but at least get that walking in. And then there's a number of other things that you can start doing. We did talk about the Wi-Fi. And so that whole category is brain protection, turning off the electromagnetic fields as much as possible in the home. And if you have persistent brain fog, you're probably going to want to hire someone that's trained with the right equipment. It's called building biology, to come into your home and measure the fields and make some suggestions on how they're going to decrease the fields. Okay, so in brain fog number 2, we're going to go into a lot more evaluation and treatment suggestions, but we like to make these episodes short so that you can get all the practical information in a short period of time. And until the next podcast, I hope you have a healthy and great day.